I'd like to ask our sponsor, Wendy, with Northbridge Community, to share a little bit about their community. Thank you, Wendy.
Thank you so much, and thank you, Generations, for doing this program today that I think is so important. I know the challenges of the world today affect us all. The COVID epidemic has been something that's turned all of our lives upside down. And hoping that today you'll have an opportunity to hear from Jen and ask your questions, and she is wonderful. We've had her do several other programs, and I think you will really enjoy today. So thank you for joining us. I wanted to tell you a little bit about Northbridge. My partner Jim and I founded Northbridge in 2004 after serving seniors in retirement living for over 15 years. And we came together because we really wanted to be different. We wanted to create environments that were safe, caring, and engaging, where people could thrive. Our motto is live well, love life, and that's truly what we want for everyone, not only our residents, but our associates and their families and ourselves. What some of you may not know is I'm not only the co-founder of Northbridge, I also happen to be a family member, like many of you. My dad lives with us in one of our communities. It's actually Stonebridge at Burlington. And even after being in this business for over 30 years, my family and I had a difficult time making the decision to make the move, to help my dad make that decision. My brothers and sisters and I worked really hard, tried to understand, would this be a tremendous benefit to him? He was living at home and he had become isolated and lonely, and his mental and physical health were declining. And I knew after serving seniors so many years that it could make a difference. It was convincing my brothers and sisters that it would make a difference. Well, I'm happy to say that today, after 5 years of him living at Stonebridge, he no longer uses a walker like he did in his house. He's painted over 30 pieces of artwork. He's refound his passion for painting, which is awesome. He writes a journal of free expression where he gets himself and his writings, along with staff members and other neighbors, to write stories, provide poems, and do art to produce this journal every other month in the community. He is an inspiration, and he is truly living well and loving life. And I thought back and I thought about this session today, and I thought of probably what's on all of your minds is we're at a point with this COVID crisis where there are so many challenges facing us, and there's so much fear on making any move, whether it's going out to a store or whether it's meeting with friends or moving into a assisted living community. I have to be very honest. My family members asked me when COVID hit, do you think we should take Dad home? And we made the conscious decision that, given all of the safety protocols that are in place, given the community he has become a part of, given the care that he receives and needs, that it would not be in his best interest to move him out of the community. And it has been the right decision, because he is safe. Our communities are very safe. We as a company put our residents, our associates' safety absolutely first in everything we do. And it's proven out. We meet every day as a home office team to talk about how we can improve our protocols and our infection control and our safety and our systems. And that has worked. We have been incredibly blessed that our communities have not been dreadfully affected by COVID. Our residents are engaged, even though there are, obviously, we are just beginning to reopen according to state and local health officials. You know, we're abiding by our each state and each town's rules as it relates to safety protocols. So we are very fortunate in that we've just reopened to family visits. I actually am going to see my dad today at 3:30, following all the safety protocols we've put in place. And we're doing, as we have been all along, we're doing small programs. We're having, we most likely in the coming months will be reopening dining. Again, very safely and very cautiously. But I can honestly tell you that, to me, I cannot think of a better place for my dad to be at this point in time. I wouldn't want him to be living at home alone. I would be concerned about him living with me or with another family member because of the lack of availability of care should he need it. And just the infection control that we provide at our communities is bar none. So I myself am very blessed and feel blessed that my dad is living with us in our communities. I would encourage you all to think that way as well. It's a difficult time. It's a difficult choice, but it's the right choice. And I'm happy to answer any questions, or if anybody wants to write me separately, they certainly can. I know that my team is on the phone here with us, Cheryl and Kristen, and they are always available as well if you have any particular questions in relation to a Northbridge community that you may be considering. So thank you for taking the time today to listen and to be involved in Generations presentation. And I look forward to seeing you or talking with you at some point in the future. Thank you so much.
Thank you so much, Wendy, and all of our Northbridge representatives today for sponsoring this event. Okay, have you ever considered a move to senior living? Has this healthcare crisis made you rethink everything? Are you trying to help an older loved one make decisions about whether to stay home or to move? If you answered yes to either of these questions, you are in the right place. Our presenter today is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University's Certificate on Aging program. She is one of less than 800 certified speaking professionals worldwide and has been featured in national media such as the Wall Street Journal, Reader's Digest, U.S. News and World Report, CBS, ABC, and many more. When she's not working, she spends her time fantasizing about when she will be able to wander the aisles of TJ Maxx and Marshalls without a break. Please help me welcome Jennifer FitzPatrick.
Wow. Wow, what a power. Okay, sorry about that. Just wanted, Stephanie, can you just make sure I'm unmuted? I keep getting muted. Okay, it looks like I'm there. What an incredibly powerful story that looks like we're good to go, that Wendy shared about her own family. Everybody is struggling with that decision right now. If they were perhaps thinking about themselves moving to senior living, or a parent or a loved one, everybody had those thoughts. And I really applaud Wendy for sharing the challenges that she and her family went through, not just initially when moving dad to senior living, but also when the COVID panic hit. I, as a professional in this field, and I bet that all Stephanie and Wendy and Kristen and Cheryl, all the professionals on this program today have had those conversations with folks. I've had friends call me, say, do I move my mom out of senior living right now? And I will tell you, just like Wendy, most of them have been glad that they did not. The vast majority of them said, you know what, keeping my loved one where he or she was made the most sense. And most of those folks didn't want to move because they wanted to remain where they were. They have made senior living their home. So I really thank Wendy for being vulnerable and being transparent and sharing her personal story with her family, because I am sure that many of you can relate to that today. So before we move on, we're going to start out with a poll. I'm going to ask everybody Stephanie to pull up a poll, and I want to ask everybody to join us with this poll. And I just want to take your, not really, but I want to just take your temperature psychologically. And I want to ask you from the beginning of this healthcare crisis until now, so from March until now, July, for those who are joining us live, what has caused you and your loved one the most stress? And so unable to get essentials like toilet paper, I know that was pretty stressful for a lot of people. Constantly changing safety guidelines. It's like what we're supposed to do today maybe wasn't what we're supposed to do yesterday. Maybe not being able to get your favorite food or other non-essentials but desired items. Maybe your favorite ice cream, maybe something that you wanted to buy on Amazon. Feeling lonely, anxiety about health, missing family and friends, missing some of your in-person favorite activities like exercise class, scary media coverage, and then there's a box for other if you want to hit other, and then we write in the chat section what that is. So if everyone would please take a moment to share with us what's caused you and your loved one the most stress. So we'll give it a couple more moments, Steph, to tally up that poll. If you haven't voted, we'd love to hear where you are right now, from the beginning until now. What's been the most stressful thing for you? So, wow, the top ones. So no one's really where it was so stressed about toilet paper, but a couple ones. The constantly changing safety guidelines are the 25% of you said that, and 25% of you said missing your favorite in-person activities, exercise class, book clubs, parties. 17% of you said missing family and friends. 17% of you said the scary media coverage. And 8% of you said not being able to get favorite non-essential items. And 8% of you said anxiety about health. So I really appreciate everybody sharing what their concerns were. So we're going to speak to all of those during this program. And so obviously, everybody has everyone's under stress right now, but everybody is dealing with stress or has feelings of stress and worry and restlessness and anxiety, but all for different reasons. Let's talk about quality of life before COVID. So you're seeing right now a picture of myself and the actor-activist George Takei, who I got an opportunity to meet about 5 years ago for a few moments. And George Takei, you may recognize him from Star Trek. He put together a play on Broadway called Allegiance about his life in a Japanese-American internment camp. He's written books. He has all kinds of over 10 million followers on Twitter and Facebook. And he, I believe right now, is 82 years old. And so somebody like George Takei has an idea of quality of life, working, still out there, doing his activism on social media, which a lot of people that are older than baby boomer age don't even utilize. But work and being out in the community, very, very important to somebody like George Takei, having a public persona, doing activism. I want to compare somebody like a George Takei to my grandmother. And my grandmother, this is one of my favorite pictures of my grandmother with her best friend, my Aunt Marion. They were best friends for over 80 years. And my grandmother's idea, even up until when she passed away at 85 and a half, her idea of quality of life was completely different from somebody like a George Takei. All my grandmother really cared about as she was in her 80s was, 70s and 80s, is being around family, being around friends. She had long since, she had worked, but she'd long since retired. She enjoyed going swimming, going to the beach, going to the pool, she loved going out to eat and just spending time with family and friends. And so her idea of quality of life, a whole lot different. And so whether you find yourself closer to my grandmother, closer to George Takei, or maybe somewhere in between, maybe you like to do volunteer work, maybe you like, and again, I'm speaking to you if you're a family caregiver. Obviously, we're talking about your loved one, your older loved one, or if you are somebody that's considering a possible move at some point to senior living, we're talking to you. So it can be all kinds of range of what quality of life means to you. And in order to be making decisions during this time, this very stressful, very uncertain, very scary time, I think it's so important to be thinking about that concept. What is quality of life to you? Wendy just talked to us about her dad's situation, and it seemed like she and her family made the decision to keep him at the community, at a Northbridge community, because it would have been disruptive to his quality of life. Listen, everybody's quality of life has been disrupted in one way or another because of COVID, everybody's. But at this time right now, what's going to be the best quality of life during these challenging times? So I want you to consider, again, your life, if you're the older person who is trying to make decisions about your future. And then if you're a daughter or son or grandson or niece, I want you to be thinking about your loved one, your uncle, your mom, your grandparent. But I want you to be thinking about your life and weighing your quality of life almost like a pie. So you see the different sections. So some people really, all she would really be really as mindful about, she didn't so much care in later life about an intimate relationship. And we had very deep conversations about this. She didn't really care about doing work or volunteer work. So those two parts of the pie weren't hugely important to her. But the rest of it was. Spiritual health was a big part of her quality of life. Social. She didn't think too much about psychological health, but it definitely was important to her. Physical health, financial health. Some people put more stock in one piece of the pie or two pieces of pie. So I'd like to just ask everybody to be thinking about maybe the 2 or 3 pieces of the pie that are most important to you or to your loved one. Which are the most important ones? And I know that this can be hard because it's almost like, would you rather have your arm or your leg? But if you really think about it, what do you believe is most impacting whether or not you have quality of life? So just take a couple moments to think about that. So I want you to be thinking about, how is you or your loved one's quality of life today? So on a scale of 0 that you feel like you have no quality of life, that your finances, your social life, your spirituality, your physical health, everything we just talked about is at an all-time low. Or maybe some of you are actually saying, you know what, I'm at the maximum quality of life. Maybe you're saying to yourself, I'm an introvert. I don't really like being around people. I've been home. I'm doing Skypes and Zooms and I'm all good with that. And you really feel like your quality of life is at 100. If you feel comfortable, if you would like to share where you or you believe your loved one's quality of life is, feel free to write in on the chat section. We'd love to hear from you. But I want you to be thinking about that number, whether or not I would love to hear if you want to share with us your number. Give us your number if you're at a 5, a 10, 100, 80. But also, even if you don't share it with us, I want you to maybe write that number down on a scratch paper and think about that. We're going to talk about that as we go through the rest of this program. So if anybody feels brave enough to share their number, we got somebody just wrote in. Okay, it was just a comment. Nobody wrote in their number, but if you want to write in your number, we would love to hear. So where's your quality of life today? So whatever that number is, I want you to be thinking, so if it's on the lower end, so especially if you're under 60. So I teach college, and I have for almost 20 years, part-time, been an adjunct for a really long time, teaching health sciences, gerontology, business. But if you're under a 60, so 60 is a D for, in college. If you're under a 60 or under a 70, I want you to be thinking about what parts of the pie are not going so well for you. What parts of the pie could use a boost? So again, if you're under 60 or 70, where could we enhance or improve your quality of life? And I'm guessing most people, at least especially right now, with all the craziness that's going on, most of us are probably not at 100 or 90. But we can, wherever we are today, we can boost our quality of life. So again, at any point, if you'd like to make a comment, share, question. So we're going to do one more poll right now. And the question is, and I'm going to ask Stephanie to pull that up, if you were ever to move yourself or a loved one to a senior living community, what would be your motivation? And so this goes back to the pie. So what would, if you ever were to move, and we know that you may or may not at some point, you might just be on this strictly for information, but if you ever were to go ahead and move, what would be the motivation for either you or for your loved one to move? And feel free to check all that apply. We'll give it another couple of moments and Stephanie can tally us up. So safety or security, physical health resources, mental health support, meeting new people, being around others, more stimulation, activities, hobbies, classes, or access to transportation. So if everyone would take a moment and feel free to check all, if all would be your motivation. So the highest two, 64% are saying safety and security. 64% are saying meeting new people, being around others. 73% are saying physical health resources. So the top one is physical health resources. The second tied, safety and security, meeting new people. 55% of you said more stimulation, hobbies, classes, activity. 18% of you said access to transportation, and then 9% of you said mental health support. So thank you all for participating in that. So it shows you the physical health resources are the top one, and then safety, security, meeting new people would be second. So one last poll, your mindset, and again, Wendy was so vulnerable and transparent, sharing all of the thoughts that she and her family went through. And I'm wondering if you could share a little bit about where your mindset is, you and your loved one, and your readiness to move. So it ranges right now. Some people are ready if they're really seriously considering it because they've spent a lot of time maybe with their loved one and they've noticed that the person has more needs than they really thought during this quarantine period. And some people are just really scared. They're not ready at all yet. They're very anxious. So Stephanie just posted the poll, and we're just asking for you just to choose one. What is your mindset? And the one would be I or my loved one are ready to move in the next 30 days. The second one is I or my loved one were ready to move this spring, summer, but now there are second thoughts because of the pandemic. I or my loved one will probably be ready to move to senior living this fall or winter. And then the last one would be I or my loved one have no plans to move to senior living in the next 6 months. So let's see where everybody is. Give Stephanie a couple moments to tally up the results. Okay, oh, this is interesting. Very, very split. So nobody's really ready in the next 30 days. About 30% of you said fall and winter. About 20% of you said you were ready to move this spring, summer, but you're really having second thoughts because of the pandemic. And about half of you said no plans in the next 6 months. So, okay, great to hear where everybody's minds are. So for those of you who are really thinking about moving this fall and winter, we want to gauge, can you get those quality of life needs met and boosted for yourself or your loved one? And then for those of you who are saying, no plans in the next 6 months, there's a couple things I want you to be thinking about as we go through the rest of this program. One, if you're not ready to move your loved one, how can you boost his or her, or yourself, how can you boost his or her quality of life without moving? Or is it possible that moving might be the answer to boosting some of those quality of life needs? And again, unless you or your loved one you're at absolutely 100%, I want you to be thinking about that right now. So what are the areas of quality of life that could potentially improve with a move? Now, a lot of people right now are skeptical because, number one, our older adult industry has been clobbered by the media. There have been a lot of very, very negative headlines and articles that nursing homes, these terrible things, deaths, and what have you. What I want to remind everybody about, though, is Northbridge is senior living. It is assisted and independent living. It is not a nursing home. It is very, very different. And sadly, I am fortunate enough that I do get interviewed by the media quite a bit, both national and local types of media, radio, television, newspapers. And I can tell you that a lot of times I have had to explain to media the difference between the different levels of care. And so if you're concerned about an outbreak or something of that nature, it is really important to understand how different assisted living is, or senior living is, than an independent living is, rather than nursing home. It's very, very different. There's a lot more privacy. There's a lot more ways to keep people separated during periods where that's the appropriate thing to do. So I know that a lot of people mentioned activities, and that was hobbies or classes. And I know that one thing to keep in mind is when you're home, if you're on quarantine by yourself or with maybe one other person and you are worried, you're social distancing, it can be really hard to engage with others in a meaningful way. One of the things that Northbridge has done is they have done some of the hallway activities with social distancing. They're starting to plan on doing smaller group events. So if that's an area of quality of life that you're concerned about, and if it's not something that you're able to do right now, it's something to think about. I fully believe we are going to get back to where we were 4 or 5, 6 months ago, where everything was senior living. Everybody was going to all the activities they wanted. Everybody's back doing Zumba classes and yoga classes and art classes and taking trips to theaters and wonderful cultural activity. Right now, though, in Northbridge communities, there are still a lot of engagement and activity. So the other part of that to keep in mind, that meeting new people part, is if you and your loved one are maybe home by yourselves, or if you as an older adult are just alone and you're completely social distancing from others, are you limited in the number of people that you are seeing? And what I mean by that is maybe it's just you and your daughter, maybe it's just you and your husband. When you move, if you're wanting to engage with others, meet new people, have activities, I'm not saying it's going to be like it was in February right now, but it will be a lot more planned activities than you potentially are going to be able to do on your own in the private home. So it's something to think about. So for those of you who feel like you don't have quality of life now, and a lot of you, actually most of you indicated physical health was one of the areas that you were most concerned with, I want you to be thinking about the possible consequences of waiting to make a change. Because some of you said, I'm not ready for at least 6 more months. Well, again, I know that there's been a lot of media and a lot of news stories about nursing homes. Again, not the same thing as senior living, assisted living, independent living, just very, very different, just completely different. But if you're concerned about your own physical health or your loved one's physical health, we see a lot of people right now very nervous to go to the doctor for routine appointments, to get blood work done. One of the things that a community like Northbridge is still being able to do is temperature checks, or checking out if you feel like, is it allergies, is it something else? Somebody's able to help you. They have the healthcare on site that they can check in and try to help you and see if you need help. I think that that's really, really critical to know that somebody is there, somebody that has healthcare professional licenses is on site. So if healthcare is important to you, it might be something to be thinking about. So now, on the other hand, you might be somebody that says, you know what, I'm fine going to the doctor. I'm comfortable with telehealth visits. But that said, if you're somebody that this is something that's concerning you and it would give you comfort to have some nursing staff, some staff that understand, that they can do some of the vital signs, that can maybe talk to your physician if they've observed you personally, that might be something to think about. Some people have been really stressed out about gyms being closed, for example, and that's having an impact on their physical health. And maybe they don't have the equipment that they want at home, or it's too hot to go outside and run or ride your bike right now. I heard a really beautiful story from Cheryl Forbes at Northbridge that one of the ways that they've been trying to adapt and adjust and make quality of life as good as possible for their residents is, for example, their gym had to close, their exercise rooms had to close, but if a resident wanted the exercise bike brought to their apartment, they were able to make that happen. And I don't know, if you don't have a bike, a Peloton bike or something like that in your house, isn't that a nice something? So again, what I'm saying is, if that's something that's important to you, having access to those types of exercise equipment, is it the same as going to an exercise class with a group of people that you're getting to know and having fun with? No, I'm not here to tell you it's the same thing. But what I am saying is that if that's an area of your life that you feel like you need a quality of life boost, it might be worth considering. Is this something that it's something that I didn't know about, something that could happen if I made the change to move to senior living? I've heard a lot of people over the last few months say, well, what's the point of moving to senior living? If you're not able to do activities, if you can't do the same things you were able to do in February. It's interesting because a lot of people have said that, but I'll tell you, even though maybe residents in senior living have had challenges maybe adapting and adjusting to this temporary situation, and it's taking way longer than most of us ever wanted it to, believe me, I can't say that's incorrect, but people are not moving out of senior living. They're seeing the benefits. So for example, back when, I don't know about so many of you, for yourself or your loved one, do you remember back when you couldn't get the kind of peanut butter that you like because all the stores were running out of, say, Jif, or you couldn't get the kind of lemonade that you prefer, or the kind of coffee? I know my husband really likes Dunkin' Donuts coffee, and I do too, but when we order it from the grocery store, we couldn't get a pack of Dunkin' Donuts coffee. We had to get this generic kind. So we all have been through that. One of the advantages that senior living has, the relationships with vendors, being able to get hold of certain products and PPE. So especially if health, if food, some of you did check off that one of your quality of life disappointments was not being able to get certain types of food or certain desired items, not essentials, but desired items. And the fact that Northbridge was able to say, send somebody out to get your favorite kind of ice cream, and that you wouldn't have to do that, or a loved one wouldn't have to do that lives an hour away. Those are some boosts to quality of life. And again, every family, every individual needs to make decisions about what makes sense for them. What is the best for them? Especially though, if you have a chronic condition, and if you don't have access to a lot of family and friends because of social distancing right now, and physical health is on your mind, it might be a good idea to consider moving and not waiting for the possible consequences of making a change. Here's what we want to avoid. And unfortunately, and again, I am a full believer, and I write about this in Cruising Through Caregiving, every individual, every family has to make decisions what's right for them. But here are some signs that you've got a situation on your hand. This is what we want everybody to avoid. We want to avoid you being lonely. Loneliness is subjective. That's something that only you or I as an individual can define. It's how we feel. It's a feeling of lack of connection, lack of intimacy. If you're feeling lonely and only you can decide that, that's something to be considering as far as your mental health and your physical health go. Have you ever felt lonely? Probably most of us would say that we have. Social isolation, on the other hand, is more objective. It's not the same as social distancing. So social distancing, and a lot of experts say that we should call that physical distancing. But social isolation really means that that other people can objectively say that I don't have contact with others. I have low contact with others. So some of you might be saying, well, I'm at home and I'm supposed to not go out because I have some, maybe some comorbidities and I'm older. How am I supposed to have contact with others? Well, this includes writing letters, phone calls, you're on an event like this. I'm not sugarcoating it. This is not the same as us being in person. I wish I was in person with you. I know that the team at Northbridge, I'm sure that they wish that they were in person with you too. But right now that's not something that can be done because of the regulations. So, but Zoom calls and FaceTime calls and interacting on social media and hallway activities and writing notes and writing letters and writing emails. So what we want to do is, if we're not having those in-person time, we want to be boosting the contacts with others, whether they be through phone, email, whether they be through text. And believe me, I know there's a lot of older adults that don't do text or perhaps don't do email. They're not all like George Takei, really savvy with social media. But we want to boost contact with others if somebody is isolated. The former Surgeon General, for a long time, we were hearing how awful it was that we all sit too much and that's the equivalent of smoking 15 cigarettes per day. But the belief is also that loneliness and low social connection is also associated with the same risk as 15 cigarettes per day, which is pretty unbelievable. So again, a lot of you had mentioned in one of the reasons that you would consider senior living move is really about that connection, classes, meeting new people. If you are isolated and or lonely, or both, there are a lot of risks. The increased risks for abuse, being neglected, self-neglect, financial exploitation. Right now, the financial exploiters are out there. They've got the COVID scams. There is so much going on. I mean, you've probably all received a phone call or an email, somebody saying that they are a prince from some foreign country and you've been left a pile of money. I've known folks who have gotten telephone calls saying that their grandchild was kidnapped. But right now, one of the hot scams that's happening is people calling your house or even knocking on your door or emailing and saying, I have the vaccine for COVID, it's early. And older adults are very vulnerable to this. When we are alone with our thoughts, we're isolated, we're lonely, we are more at risk. And I will tell you, for those of you who are family caregivers, so much of abuse and neglect is not intentional. But when a family caregiver is pushed to the limit because they are burnout and exhausted, we do see an increase with abuse and neglect. If someone's living alone and they are lonely and isolated, we see increased self-neglect. So again, these are reasons. So again, it may be the right time for you to say, let's move to senior living. But if you're still saying, I'm not sure, we want to be thinking about how do we reduce isolation and loneliness? What are we going to do as a family or an individual to make sure that we don't experience these increased risks? Physical consequences, we are increased at risk for stroke, for sleep problems, for having more accidents if we're lonely and isolated, increased risk at heart attack, and more risk for suicide. During this difficult time, suicide hotline calls have gone up dramatically. So there are lots and lots of data, even before COVID, that loneliness and isolation are associated with much of these increased physical risks. The psychological and cognitive consequences, depression, fatigue, substance abuse. We see a lot of people using prescription drugs, abusing prescription drugs, drinking more alcohol, using illegal drugs more. The psychological and cognitive consequences of isolation and loneliness. Also, there is some data to suggest an increase in dementia. And if someone already has Alzheimer's, there are some small studies that indicate that there can be more hallucinations. So I want to invite everybody, if you have a comment, if you have a question, feel free to jump in at any point. We want you to get what you need from this program. We really do. And again, senior living could be a great answer to what's going on, depending on where you scored your quality of life. If you're telling me that your quality of life is 80, 90, 100, it may not be the right time for you. But if you or your loved one are 60 or 50 or 40, would it be a good solution to take more seriously the idea of moving to senior living now? And if you decide that it's not, you still want to be thinking about what can you do to reduce isolation and loneliness during this difficult time. In making decisions, I write a whole chapter in Cruising Through Caregiving called Your Older Loved One is an Adult. We are all grown-ups. Even somebody who has dementia, they are still an adult, they are still a grown-up. That said, of course, when somebody has Alzheimer's or another type of dementia in the advanced stages, we, family caregivers, we have to start making decisions on their behalf because they might not be making safe decisions. They might not remember decisions that they've made. That said, there might be that you yourself are thinking, you know what, it's time, I'm ready to move. And your daughter might be saying, oh, Mom, I think, I'm scared about COVID. I don't think it's a good idea. We're all grown-ups and we all get to have an opinion on what's happening right now and if it's the right time. But it's really important, especially for family caregivers, to remember that their parents are adults. I will say it over and over again. Everybody who's over 18 or a grown-up, and if you don't have advanced dementia, you do get to make that final decision. So what I would say for family caregivers, and it can go both ways, that the older loved one isn't ready, doesn't want to move, but the family's saying, it's time, you're going to get better quality of life. Know that you always, if the person doesn't have advanced dementia, you always have to be respecting where they are. Now, that said, if maybe you're a family caregiver and you're saying, well, Dad lives alone, he doesn't have dementia, but he is absolutely against moving to senior living. He wants me to make dinner every night. He wants me to pick up all his medicines. He wants me to do his laundry. That said, I do believe it's important to set limits with your loved one. If he or she said you believe that the right move for them is moving to senior living, but they're thinking, no, you know what, if you're cooking all my meals and you're doing all my laundry and you're coming by all the time, even social distancing, that everything's under control, be mindful about propping your loved one up. Sometimes a person believes that they're functioning much better and more independently because they don't realize how much their loved one is doing. So if you're getting burnt out, you're homeschooling your kids, you've got so much going on and you're bringing Dad dinner every night, it might be, hey, Dad, I can only bring dinner 3 times a week. And once we pull back a little bit, sometimes that person that we love will sometimes start to think, well, wouldn't it be great if I was at a senior living community where gourmet meals were available every night, which, by the way, was one of the really interesting advantages that I've heard from a lot of older adults during this time. One of the things they were so happy about staying in senior living is because of great meals, even though group dining was put on hold, that they got good, healthy, delicious meals every day. We also want to keep in mind and never forget that when you're having these conversations with your loved one and you're trying to make these decisions, never mind COVID, never mind senior living, any moving is always stressful. So I actually have my house up for sale right now, and my husband and I are really excited to sell it. But I gotta tell you, I know that it's still, even though we're excited to move to the house that we would prefer to be in, moving is gonna be stressful. We always have to remember that no matter what, there is going to be some additional stress, and just be prepared prepared for it. Realize that if you do make the decision, whether it's now or whether it's in a month or 6 months, then just give yourself a little bit of space to just deal with the stress. Because even if you're moving from an apartment to your dream house, it's still stressful. Moving to senior living can be very emotional and it can be very stressful. So you want to just give yourself space and give yourself the energy. Try to limit other stressful activity going on in your life as much as you can, as hard as that may be. But again, moving during COVID, very, very stressful. One of the things that is great about Northbridge is they have specific vendors that they work with that make the moving process much less stressful, that make it very COVID compliant. And so if that's something that you're interested in hearing more about, I know that the team, Cheryl and Wendy, can help with that in terms of referring you, because it's so great when you know the vendor is following the protocol and the rules that are necessary. When you're making decisions about senior living, and maybe you and your loved one, maybe it's you're in a spousal relationship and one of you's ready and one of you's not. You know, sometimes if the wife is saying, you know what, I think we're ready, it's time, this is a good time to make this decision, because gosh, as hard as it was during this COVID period, you know, what if there's another surge? Think about who should communicate. A lot of times, if somebody hears the same message over and over again from you, it starts to become that they need to hear it from somebody else. So maybe it's an adult child who hasn't really weighed in yet, or maybe it's a priest or a rabbi or a minister that you trust, or maybe it's the family physician you ask to have the conversation. But sometimes when we make our case over and over and over again to somebody we care about something that we think that can impact their quality of life in a different way, sometimes they can't hear it from us anymore. So sometimes it might be helpful to, you know, talking to a care manager, talking to a discharge planner at the hospital, those sorts of things. Yeah, so Liz says, this has been great. Do you have suggestions for when you think someone would benefit from senior living, but they refuse to try it? So these are actually, I think, talking to them about the quality of life pie, and you can download this PowerPoint when you're finished. We can send this PowerPoint to you. Northbridge will have it, and the recording as well. You can listen to it again. But a couple things. I think bringing in a different person to make this suggestion. For a lot of adult kids, their parents always will look at you as a child. They never are going to look at you as somebody that knows their best interests. So it might be that the doctor or a care manager or a religious figure needs to jump in. But I also think, Liz, what we were just talking about pulling back a little bit of support. I'm not saying that you stop visiting dad, you stop bringing him meals, but if you're doing dad's laundry, making all his meals, visiting him 7 days a week, you're doing all these different, you're propping him up and you're making him dependent on you. When you pull back a little bit of that support, sometimes that is a wake-up call for the person who might be a good candidate for senior living. Now, I want to be very clear, you don't want to do that with somebody who has dementia. When someone has advanced dementia, there's other ways, and I would recommend talking to the team at Northbridge about how to do that, because that is a very different situation. You don't want to just leave that person alone and pull back support, because that can be very, very dangerous. But there's a lot of ways that you can, and that's actually a whole nother seminar. That's a whole nother virtual webinar, but there's a lot of resources about that on my website too, though. So in terms of making decisions, what's in it for you? What's in it for your loved one? So if you feel like moving your uncle to senior living, what's in it for you? Well, this fall in my area, we have to homeschool again. I don't know if I'm going to be able to run over to Uncle Joe's every day, or I'm not going to have to be worried if he gets sick, or if he does have COVID, or if he gets the regular flu. I'm not going to have to be concerned about it if he's in a senior living community where they have the health resources to help. What's in it for your loved one? I think it goes back to looking at the pie. Have them assess where their quality of life is today. What's stressful about moving for you? What's stressful for them? decisions about moving, unless somebody has a major health crisis, these conversations are often not one conversation. Yep, time to move. Often this takes place over a couple weeks, a couple months, but during this period of so much uncertainty and challenges, if it's been hard for you or your loved one to maintain and thrive at home, it's definitely something to be talking more about, to be thinking, what's been most stressful about this time for you? Give them that poll that we talked about earlier. So what I want to end on is that if you start looking at where your quality of life is, if you are at a 60 or below, even a 70 or below, you or your loved one, I want you to be thinking about all those areas and where can we boost. Senior living is a great option. There are a lot of advantages. Some of the things that went on during the COVID period, and we're still in that crisis period, the meals, the grocery shopping, if somebody needed something special that wasn't available at the senior living community at Northbridge, the healthcare on site, the example that I said about bringing the exercise bike. I mean, who wouldn't want that? If you're saying, you know what, I really need to blow off some steam, I'd love to have somebody to bring the treadmill or the bike. For people who are not adept with technology during this time, and a Zoom call was going to give them some of those social contacts to reduce social isolation, iPads were lent to the residents, and they were taught technology if they were interested in learning it. So there's a lot of advantages, and I just want to leave you again with the last thought. Nursing home is not assisted living, is not senior living. Any story that you're hearing, and by the way, a lot of nursing homes are doing just fine. They're not having big outbreaks, but a lot of the scary headlines and scary stories that you saw early in this pandemic were very much about nursing homes, and they really don't have anything to do with organizations like Northbridge. It's very, very different situations. So always remember that when you're talking, if you're talking to somebody that you love who is reading that and is scared by that, just try to emphasize that it's not the same thing. So please, during this time, think about it. But whatever you decide, we want to be looking at your life as a pie. Where are the areas where you want to boost your quality of life during this time? It's a challenging time for all of us, and I wish you all the very, very best. If you'd like to get a free chapter of Cruising Through Caregiving in the worksheets, just go to cruisingthroughcaregiving.com, and we'll be glad to get that out to you. And I'm going to turn it back over to our team at Northbridge, and I'm going to pull up their slide.
Okay, I think we're looking to see if Wendy is available or wanted to have any closing remarks.
Hi, Jennifer, it's Wendy.
Hi, Wendy. Welcome back.
Thank you so much. And thank you for doing this. It was very, very informative and helpful. And I just want to thank everybody for attending our webinar. You can see on the screen, you can learn more about our communities. As I said, Cheryl and Kristen are two people that you can reach out to. You can visit us online at www.northbridgecos.com. And you will receive an email link which connects to one of our helpful advisors, and they're happy to chat at any time. I'm happy I got an opportunity to chat with you a little bit today about our company and also my own personal experiences, and hopefully it's given you some food for thought. And we hope to see you at one of our Northbridge communities soon. Thank you.
Thank you so much, Wendy, and for all of all of your generosity in sponsoring this team. Thank you to Jennifer for talking about such an important topic, and thank you to the attendees. I'm so glad that each and every one of you were able to make it, and hope you found it very helpful. I have posted a link to a short survey, so if you wouldn't mind just taking a few minutes to fill it out and let us know your thoughts on the program. We always like to get some feedback. And again, thank you so much to Wendy and her team at Northbridge's community for sponsoring today's event. I hope everybody has a wonderful day and that you stay safe, and you know, we're all in this together. Have a wonderful afternoon.